good thing to do. Because in children, the vaccination has been pretty much perfected, the universal vaccination program. So well established, government is doing an amazing job of this. Such a large country, such a great supply chain, the way vaccines are delivered to the remotest part of India, and we have been able to conquer many diseases which were never expected to be controlled. So as a nation, we have done extremely well with children. And I'm sure in the adult vaccination area, there's a lot to be done. As a private organization, we definitely need to supplement the effort of the government. Government has got a million other things to do. As private organizations, when we see patients coming through our doors with so many challenges, so many problems, we are extremely poised and at the correct spot to advocate adult vaccination and see how we can help them get on top of their health. We have no idea how many working days are lost because of so many people feeling ill, because of flu, pneumococcal pneumonias, and vaccination is an amazing game. It's a world in itself. It can prevent viral infection, it can prevent bacterial infection. Now we know that the HPV vaccines and all of that can prevent cancer. So it's a very, very powerful thing to embrace and have a huge advocacy. And we as Sparsh, partnering with Zydus, would like to feel part of this campaign. One organization will not be able to solve the problem at a big level, but somebody has to initiate, somebody has to become the forerunner. We thought it's a great opportunity for us to be part of this great country's nation building effort. So that's why we are here today trying to do this initiative, and we will do it with all our strength and energy, with all the commitment, and structure it appropriately. So anybody walks with a broken bone also in the hospital knows about the vaccine, and they know that it could be of immense help to them. And when we give these vaccines, there is a tipping point. When we vaccinate more than 60-70% of the population, it invariably tends to arrest the endemic proportions which it can gain. It can arrest the furthering of these illnesses, and in some ways the herd immunity comes in. We cannot afford to have one more COVID in our lifetime, so we have to do everything possible to prevent it. Thank you once again. I think the biggest role is media to spread this beyond and inspire a lot more people to take it up. Beyond government, of course, will do the initiative. This talk has been happening in the parliament as well, but government effort augmented with private sector effort, which plays a major role in the healthcare of our country, not just Sparsh. Hopefully this becomes a movement, and more private organizations participate and make this initiative a really worthwhile thing. And we have to be counted among the developed countries. This is one of the most important things to do. Thank you again. Thank you. Producing vaccines, some of them are definitely proven, some of them are yet to be proven, but the data that's available, people have had vaccine, how like Ranjan heard, how all healthcare workers which had a massive hit first time, second time they didn't have. That data is available to show how useful it is. Side effects agutte, ಖಂಡಿತವಾಗ್ಲೂ ಏನು side effects ilva, benefits versus risks one has to weigh. But we strongly feel benefits far outweigh the risks. But John, you want to answer that?
So, sir ಹೇಳಿದಂಗೆ ಯಾವುದೇ ಒಂದು ವ್ಯಾಕ್ಸಿನ್ಗೆ ಎರಡು ತರದ ಅಡ್ವರ್ಸ್ ಎಫೆಕ್ಟ್, ಸೈಡ್ ಎಫೆಕ್ಟ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಒಂದು ಮೈನರ್ ಅಡ್ವರ್ಸ್ ಎಫೆಕ್ಟ್ಸ್, ಎರಡನೇದು ಸೀರಿಯಸ್ ಅಡ್ವರ್ಸ್ ಎಫೆಕ್ಟ್ಸ್. ಮೈನರ್ ಅಡ್ವರ್ಸ್ ಎಫೆಕ್ಟ್ಸ್ ಮೆಜಾರಿಟಿ ಆಫ್ ಪಾಪ್ಯುಲೇಷನ್ ಕಾಣಿಸ್ಕೋಬಹುದು. ಸ್ವಲ್ಪ ಮೈಕೈ ನೋವು, ಒಂದು ಹಾಫ್ ಡೇದು ಫೀವರ್. ಸೊ ಇದು ಬಂದು ಮೈನರ್ ಸೈಡ್ ಎಫೆಕ್ಟ್ಸ್. ದಿಸ್ ವಿಲ್ ನಾಟ್ ಸ್ಟಾಪ್ ಅಸ್ ಫ್ರಮ್ ವ್ಯಾಕ್ಸಿನೇಟಿಂಗ್ ಎವ್ರಿಬಡಿ. ಸೀರಿಯಸ್ ಅಡ್ವರ್ಸ್ ಎಫೆಕ್ಟ್ಸ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಸೀರಿಯಸ್ ಅಡ್ವರ್ಸ್ ಅಂದರೆ ಒಂದು ಅಂಗಕ್ಕೆ ಡೇಂಜರ್ ಆಗ್ಬೋದು, ಒಂದು ಕಿಡ್ನಿ ಫೇಲ್ಯೂರೋ, ಕಾರ್ಡಿಯೋಮಯೋಪತಿನೋ, ಬ್ರೈನ್ ಎಫೆಕ್ಟೋ, ಇಲ್ಲ ಒಂದು ಎಕ್ಸ್ಟೆಂಡೆಡ್ ಸಿವಿಯರ್ ಸೈಡ್ ಎಫೆಕ್ಟ್ ಅಂದರೆ ಬಿ ಪಿ ಡೌನ್ ಆಗ್ಬೋದು, ಪಲ್ಸ್ ರೇಟ್ ಜಾಸ್ತಿ ಆಗೋದು, ಈ ಥರ ಸೀರಿಯಸ್ ಸೈಡ್ ಎಫೆಕ್ಟ್ಸ್. ಸೊ ಯಾವುದೇ ಒಂದು ವ್ಯಾಕ್ಸಿನ್ ಮಾರ್ಕೆಟಲ್ಲಿ ಬರೋಕ್ಕೆ ಮುಂಚೆ ಮಿನಿಮಮ್ 8 ರಿಂದ 10 ವರ್ಷ ರಿಸರ್ಚ್ ನಡೆಯುತ್ತೆ. ಮಿನಿಮಮ್ 1 ಮಿಲಿಯನ್ ಪೀಪಲಲ್ಲಿ ಅದು ಅಡ್ಮಿನಿಸ್ಟರ್ ಆಗುತ್ತೆ. ಅದಾದಮೇಲೆ ಈ ಡೇಟಾ ಕಲೆಕ್ಟ್ ಮಾಡಿ, ಬಿಕಾಸ್ ಇಟ್ ಈಸ್ ಅ ಪ್ರೋಗ್ರಾಮ್ಯಾಟಿಕ್ ಇಂಪ್ಲಿಮೆಂಟೇಷನ್, ಲಕ್ಷಾಂತರ ಕೋಟ್ಯಾಂತರ ಜನರಿಗೆ ಕೊಡುವ ಇನಿಷಿಯೇಟಿವ್ ಇದು. ಆ ಥರ ಇಂಪ್ಲಿಮೆಂಟ್ ಮಾಡೋಕ್ಕೆ ಮುಂಚೆ ಇಷ್ಟಾದ್ರೂ ಮಿನಿಮಮ್ ಡೇಟಾ ಇರಬೇಕು. ಮೈನರ್ ಸೈಡ್ ಎಫೆಕ್ಟ್, ಟಾಲರಬಲ್ ಸೈಡ್ ಎಫೆಕ್ಟ್ ಅಂತ ಕ್ಲಾಸಿಫೈ ಮಾಡಿ ದಟ್ ಆ ಒಂದು ಕಾರಣದಿಂದ ಯಾವುದೇ ವ್ಯಾಕ್ಸಿನ್ ಅನ್ನು ನಾವು ರಿಸ್ಟ್ರೈನ್ ಮಾಡೋದಿಲ್ಲ. ಸೀರಿಯಸ್ ಸೈಡ್ ಎಫೆಕ್ಟ್ ಇಫ್ ಇಟ್ ಇಸ್ ಸಿಗ್ನಿಫಿಕೆಂಟ್ ನಂಬರ್, ಅದಕ್ಕೊಂದು ಸ್ಟ್ಯಾಟಿಸ್ಟಿಕಲಿ ಸಿಗ್ನಿಫಿಕೆಂಟ್ ನಂಬರ್ ಇದೆ. ಐ ಥಿಂಕ್ 6.5 lakh ಜನರಲ್ಲಿ ಒಂದು ಸತಿ ಸೀರಿಯಸ್ ಸೈಡ್ ಎಫೆಕ್ಟ್ ಬಂದರೂ ಕೂಡ ಆ ವ್ಯಾಕ್ಸಿನ್ ಪ್ರೋಗ್ರೆಸ್ ಆಗೋದು ಬಿಡೋದಿಲ್ಲ ನಾವು. ಸೊ ತುಂಬ ಸ್ಕ್ರೂಟಿನಿ ಹಾಕ್ಬಿಟ್ಟೆ ಒಂದು ವ್ಯಾಕ್ಸಿನ್ ಒಂದು ಲ್ಯಾಬಿಂದ ಮಾರ್ಕೆಟ್ಗೆ ಬರೋದು. ಸೊ ಒಂದ್ಸತಿ ಬಂದಿದೆ ಅಂದರೆ ಇಟ್ ಮೀನ್ಸ್ ಇಟ್ ಇಸ್ ಗಾನ್ ಥ್ರೂ ಆಲ್ ದ ಸ್ಟ್ರಿಂಜೆಂಟ್ ಮೆಜರ್ಸ್ ಆಫ್ ಸೇಫ್ಟಿ ಅಂಡ್ ಎಫಿಕಸಿ. So we should be confident in using it ourselves and promoting it to our people near and dear ones.